Hi, everyone. I'm Steve. I'm here with Dr. Nario. Every week we have our little conversation. So thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
We're going to talk about this is such a big deal, especially seniors and people as they age and the strength of their brain and cognitive function. And I think there's a lot of people worried about cognitive function as they age. So we're going to talk about that and how to maybe protect your brain a little bit. Um, things that you can do. I mean, we'll just kind of see where it goes. If you guys are interested in interviews with doctors, nutritionists, personal trainers, subscribe to the channel. And if you want to know more about our weight loss program, use the QR code on the screen or the link in the description. So Dr. Nario is at Biointegrative Health Center in Reno, Nevada. They treat a lot of things. They come from a holistic, um, integrative perspective. So you're going to get an interesting viewpoint. If you're interested in knowing more about what they do, you can check them out online, Biointegrative Health Center. So, um, what do you think, Doc? How do we, it's something that everyone is concerned with. And I don't know if there's environmental issues or food issues, or it just seems like cognitive issues are more prevalent now than they were maybe 80 years ago. But
Right.
what are your first thoughts?
Well, Steve, when we think about again anti-aging, right, in relation to mental health, the first thing that we think about always are Alzheimer's, dementia. But again, when we think about the brain, there are other aspects of issues that we need to focus on still. So again, anti-aging doesn't just mean skin creams, joint supplements, but as we kind of like get into the topic of mental health, so this is very important also when you want to stay younger in terms of longevity. Thus, anxiety and depression aren't just emotional, they're biological accelerators of aging. Since we're talking about anti-aging here, and one of the biggest drivers of that you consider, as you asked a while ago, like exposures to an environment, even the things that we eat. So that's why the gut plays a big role in that as well. And today we will connect the dots between brain chemistry, even the microbiome, the environment, and longevity, which is what we call anti-aging medicine.
So, what do you think causes that? You said depression and other mental issues as you get older. Why is that as you're getting older? What's changing as you get older that causes some of those things to be an issue?
Right. Well, a lot of these anxiety and depression may come from past experiences, right? For example, trauma, PTSD. But when we talk about aging in relation to the onset of anxiety and depression, now we think about poor sleep because circadian rhythms are starting to change. So as we get older, we sleep, I guess, less, and we have more waking times. Low motivation because, of course, as we get older, our families go away, they get out of the house, the children gets out of the house. Now you have like you're like the families that gets now to be mom and dad again and work on their own relationships, and even reduced activity because this is where retirement age comes into the picture. That's why not only are we worried about the physical, but you also stop making the brain move, and also the exercise that you were doing every day with your job that you're involved with. So, as you can see, it's not only the environment, but the actual aging process itself brings a lot of factors to the onset of anxiety and depression. So, when you have this, so one thing that I can tell you, if somebody has this diagnosis of anxiety and depression, for sure, there's an inflammatory process happening there. May it be cytokines, oxidative stress, or you have high cortisol, leading to the shortening of your telomeres and also the mitochondrial function all going down, thus accelerating aging.
So, does that have something to do with the gut?
Yes. So the gut actually is, so you have to remember that our good guys in the colon are the ones that produce neurotransmitters. So this is serotonin, dopamine, GABA, and short chain fatty acids that influence brain health. If you have dysbiosis or abnormal growth of these bacteria, it will lead to chronic low grade inflammation and then worsens mood, accelerates aging, and also now the onset of what we call leaky gut, increases of the like what we call the endotoxins driving neuroinflammation. So the saying says, if you have an inflamed gut, you also have an inflamed brain.
So as we get older, this progresses, it gets more difficult, we're aging. So what do we do?
So really, on our end, there's so many. I mean, in relation to natural ways, so lifestyle prescriptions such as exercise, it enhances the microbiome diversity, the production of BDNF in the brain, mood regulation, mindfulness, meditation, and sleep optimization. As I mentioned to you about the fixing of that circadian rhythm. But on our end, as your clinician, anti-aging clinician, we have hormone optimization. That's one that you can't, it's hard to fix that on your own. You need to have external help for that, like estrogen, progesterone, testosterone, DHA, pregnenolone. And also, you have to remember, estrogen, for example, has a huge influence in the microbiome because the proper levels of estrogen brings richer support in a more resilient gut ecosystem. And then also supplements that our body cannot, I guess, create on its own. CoQ10, NAD, alpha lipoic acid. All of these are mitochondrial supplements that we can support our brain functions with, and even omega-3 fatty acids that have anti-inflammatory qualities. For the microbiome, definitely food. Diet is huge. Prebiotics, probiotics, all of these comes from healthy food sources, and also improves, of course, the mood. Polyphenols from green tea, pomegranate, blueberries. They actually have oxidative, antioxidant capacities, and also the fermented food. They're known to have psychobiotics, which supports emotional stability. And some of my secret weapons in my toolbox: peptides. CELAC, CMAX reduces anxiety and brain resilience. BPC 157 repairs gut lining and modulates inflammation. So there's so many things that we could do. We just need to basically identify which one you probably would be needing to prioritize.
So the peptides again are a short chain of amino acids, and some of them that you mentioned, they can be taken, some of them orally and some of them with an insulin needle, right?
Why? Well, when you're talking about the brain, if you want to penetrate that real well, you have to consider intranasal deliveries of these peptides because as you spray it up your nose, right, there's a cribriform plate, as we call it, which is actually almost a direct communication to your brain. So that's why CLANC and CMAX is best used if you're trying to target the brain as an intranasal delivery. And there are peptides still that can be helpful with injectables for sure, like cerebrolysin. You will hear that a lot. But the ones that I just mentioned are more intranasal in terms of delivery.
So you mentioned a lot of hormones, estrogen, testosterone, and so on. Now, these aren't necessarily male or female hormones because this is men and women need to get all these hormones right, right?
Correct. So with the estrogen, testosterone, progesterone, as you have to, I guess we have to remove this stereotype from everybody that when people hear estrogen, it's only women. When we hear testosterone, it's only men. So you always have to establish that those hormones are used by both genders, and we definitely need to make sure if there are deficiencies, if they are making more. Thus, testing is important. So when you do testing, you will find out which ones are needing to be addressed, which ones are needing to be lowered down. So that's why it's not just like, hey, let's start hormones immediately. You need to make your assessment. Same for the gut microbiome. You need to do your leaky gut testings, the microbiome mapping, mitochondrial function, and even another good one is genetic testing. So that's something that's, I mean, it's not new, but now it's in the forefront of trying to prevent these conditions that I just mentioned to you: anxiety, depression, even dementia, by looking at your genes and how your genes will transpire and to prevent that expression eventually.
So, what would you find out from a gene test? What would you find out? And then how would you address it?
Right. So there are companies out there that does this, but what does it bring to the table? So what it brings to the table, for example, there are gene tests now that can tell somebody on uh, what specific antidepressant, for example, that can be effective for that patient and in relation to their mental health. So it's not like you're just throwing things at them. They can actually find out which one works as your first choice. You can also find out if they're methylating properly. Because if you have bad methylation or the MTHFR gene, definitely brain function and mood is usually affected. And also for glutathione, you can find out if you're a good glutathione detoxifier. So, meaning that that's a reflection of how well you detoxify toxins that you just mentioned a while ago. And we can also find out, for example, how inflamed the brain is. And even you can derive your protocol for peptides there using specific parameters. So it's a more individualized approach when you do genetic testing. And that the thing there is, when we always say that genetics does not always mean expression, the point here is now when you're actually seeing these little signs that you're depressed, that you're actually anxious a little bit, or even memory loss, mild memory loss. Now you're starting to express that. Thus, the genetic test will now help you to prevent that from going further.
That's a lot of things that we've mentioned in this little discussion: environment, diet, addressing the gut,
Mhm.
hormones. There's a lot of things that can go off when someone's starting to deteriorate cognitively, right?
Right. That's why I tell patients that, sure, it's part of our discussions or reminders. Hey, make your mind active, play with your games, read a book, right? You always hear that. So that also helps, but there are things that we cannot control. And these are the things that we're talking about. Your hormones are going down, gut is inflamed. So all of these infections that you have. So even though you're making these right choices for you, and you're forgetting about the environment that we just mentioned a while ago, it's still going to be a rough road to go through.
So a good healthcare practitioner can look at these things and address them, kind of a process of elimination, and start addressing each one until you see cognitive improvement. Is that right?
Right. And the key there really is, I don't know if I'm getting the message through that it's always prevention. You don't want to get to that point that you're having symptoms that you want to address this. But because once you have symptoms already, it's hard to backpedal because you're playing with the brain. These are nerve tissues. That's very hard to regenerate or recover. So, again, easier said than done. Preventative medicine is always the key, but that's why you need to have guidance with this. And I know there's a lot of biohackers that I know. Oh, I'm doing this right. Forget about me seeing a doctor. But there's only some things that there's so much you could do. Blood tests cannot be ordered by an individual. Scans cannot be, because those are very helpful. And even the genetic testing that I just mentioned.
Yeah. So, you just made a spectacular point in that it's preventative. You don't want the problem to begin.
Right.
So, aware of your environment, your diet, what you're eating, what you're putting in your body, keeping your gut healthy, the right food, exercising your brain,
Uh-huh.
all those things, making sure your hormones are right, getting your hormones tested. That's a lot of tests. And, I just think that people have a tendency to wait till something's wrong until they test something.
Yeah.
Sounds
And
like
that's
you're
unfortunate.
sounds like you're saying that's not the best approach.
Yeah, because I see it every day. Sometimes we kind of, if we could, I've seen patients, if I could buy it, I'll do it. I'll do it all over again. The only thing that you can't buy really is time, because time just passed by, and now yeah, you're just
Yeah.
the could have beens, what could have. So you
And
don't want to get to
every
that point.
day,
That's why we're talking
uh,
about this now, in order
you
for
know,
you to actually
something new
not have
pops
these
up.
specific problems in
Okay,
the future.
so Dr. Nario, thank you so much for being with us. We always appreciate your input, and we will talk to you next time.